We are live, guys. I'm so excited. Tonight's been an evening with directors. So, you guys are like in for a treat. We have our second director of the evening. Please welcome Dr. Jason Williamson. I'm so
Hey, thanks for having
excited.
me.
Yeah,
Yes.
I'm so excited that you could join us. If you are joining us live, please do us a favor. Let us know if you can hear us. I am notorious for rambling on mute. I just want to make sure that everybody can hear us because this is going to get really fun very quickly. I've already been laughing so hard. Dr. Williamson, thank you for being with us. I put it out there. I always put it out there because I know many student pharmacists, their first response is they want to reach out to the current residents. I encourage it. I love it. I'm like, reach out. And then I'm like, what about the director? Have you established contact with the director? And they're like, I don't know. I'm scared or I'm unsure to do that.
Mhm.
So I felt like this forum could be a great icebreaker and just helping them get to know you a little bit before any of them feel like they're going to take a leap, which to me doesn't sound like a leap, but in their minds, it's a huge step for them. Please share with us a little bit about yourself.
Yeah, absolutely. So good to be with you guys this evening. My name is Jason Williamson. I'm the clinical pharmacy manager and the PGY1 residency program director at Ascension Genesis Hospital, and we're based out of Grand Blanc, Michigan. I also serve as a preceptor for the PGY1, PGY2 Health System Pharmacy Administration and Leadership Program, which a lot of people will abbreviate as HSPAL. It's a 2-year program that we offer where the first year of the residency program is very similar to what's accomplished within the traditional PGY1 year. And the second year really focuses in on administration, leadership, management skills, and areas that you really need to excel as a pharmacy practice manager in a number of different areas. A little bit about me. So we've already got some questions from the chat about, okay, how old are you? How long have you been out of pharmacy school? So I'm a 2012 grad from Ferris State University's College of Pharmacy. So about 10 years ago, I graduated from pharmacy school. I completed a PGY1 residency program up at Munson Medical Center in Traverse City, Michigan in 2013. And I've actually practiced at Genesis since. So I started off as a clinical staff pharmacist at Genesis. I was in that role for just under 3 years, worked in a number of different areas, including the cardiovascular care unit and surgical ICU. I covered for the medical ICU pharmacy specialist when he was on PTO,
Yeah.
worked in the core pharmacy. So kind of that jack of all trades kind of pharmacist position. Then I transitioned into a drug policy and education pharmacy specialist position, a lot of formulary management roles and responsibilities, drug information kind of responsibilities, but then also education responsibilities to nurses, other healthcare providers, physicians, and then our internal pharmacy team members. And
Gosh.
I was in that role for a whole 10 months before I was able to become the pharmacy manager. And I was already on my way to kind of starting the residency program at Genesis.
Gosh.
And it kind of segued into itself, right? So I started the residency program at Genesis for the PGY1 program back in 2017, went
Wow.
through accreditation in 2018, and we've now had, oh my gosh, it seems like 6 or 7 classes now. I can barely count, right? So it's
Wow.
been really good. Yeah.
That's amazing. Congratulations. That's so cool. So, all of the folks that are just super curious, and I was just like, these questions are so fun. It's like residency program director, dot, 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 so young, dot, dot, dot. We need to know everything. I was like, that's a statement. That's not a question, but
Yeah.
I'll definitely ask you. And I think it's also really, really empowering and encouraging for student pharmacists to hear and see that
Yep.
like basically like I think we were talking about this earlier. If you have an interest, a passion, and are pursuing that training, be lucky to be in an environment that really allows you to thrive and flourish in those positions, because you're like a prime example like of someone where you just had a desire and you went for it.
Right. Absolutely. And I was completing my residency program at Munson and I became aware of the opportunity to come back to Genesis. So I actually had my IPI experience, like my first hospital experience was at Genesis.
Wow.
And then I was an intern the following summer. And so I really knew the team that I would be returning to and working alongside. They were kind of the pharmacists that brought me up essentially when I was in pharmacy school too. And I really liked that opportunity. But I also saw the opportunities as well at the institution to grow pharmacy practice services.
Yeah.
What our pharmacists could do in our practice there would just grow exponentially. And we've really accomplished that. And I think it's really attributed to the team that's at the site and just the amazing culture that's there.
That's amazing. Congratulations. This all sounds super cool. What are the other? Many people, same general questions. How many PGY1 positions do you offer at Genesis?
Yes. So we have three traditional PGY1 resident positions that we offer annually. And then we offer a PGY1, PGY2 position annually as well that focuses on health system, pharmacy administration, and leadership. The
Gosh,
three traditional PGY1 positions that are really focused on inpatient pharmacy practice, that's an ASHP accredited program. And then the HSPAL program is pursuing accreditation. We just have to go through that process since it's a newer program, and we still have to go through that with our initial candidate.
absolutely. And then similar question related to that is early
Mhm.
commit an opportunity at your institution currently?
Yeah, good question. So we don't have any standalone PGY2 programs. We just have the 2-year HSPAL residency program. However, being a younger program, you might be curious about our ability to prepare residents to go on to PGY2 programs. And I can assure you we have the quality experiences as well as the specialists on our team and preceptors on our team that can adequately prepare residents for a PGY2 program. We have sent 4 residents out of our trained residents onto PGY2 programs, one in critical care, one in emergency medicine, one in infectious diseases and antimicrobial stewardship, and then one in medication use safety and policy. So a number of different PGY2 programs that we've trained residents for that have went on to successfully pursue those programs. We have PGY2 trained pharmacy specialists that serve as preceptors for our residency program in a number of those different areas as well, or preceptors that have equivalent experience as well. So in emergency medicine, we have 2 PGY2 trained emergency medicine pharmacy specialists.
Yeah.
Both are board certified. We have a board certified critical care pharmacy specialist who's PGY2 trained. We have a PGY2 trained infectious diseases pharmacy specialist, and then an administrator that leads our PGY1, PGY2 program that completed 2 years of residency training as well. So
Gotcha.
again, I think we can prepare
Yes,
candidates for
you
PGY2s.
absolutely can. So, and I think for anyone, prospective candidates or even P1s and P2s that are tuning into this, it's very important that you are asking some of these questions and that the directors are able to really describe to you. If they don't have a PGY2 in something, that doesn't mean that they don't have the infrastructure, the skill set, or the facility that can prepare you very well to go on and be competitive for a PGY2 position elsewhere. And I think like one of the strengths that Dr. Williamson is highlighting here that I think you guys should really tune into is that many of the preceptors in these highly specialized areas are not only PGY2 trained, they're board certified or have equivalent experience. I think this is a major strength that you should be paying attention to as you begin to kind of make your selection process. What made you decide to become a residency program director? And in your case, I'm personally interested. What was your motivation in deciding that you were going to start a program at Genesis?
Well, I think part of it was my upbringing, right? Like my PGY1 residency program that I completed after I graduated from pharmacy school, and the just the quality of the experiences, the depth and breadth of different things that I was able to experience within that first year, and the great learning environment that I had at Munson, really pushed me to say, this shouldn't be just limited to just a couple people or a select number of candidates. We really
Yeah,
need to grow this and kind of expand what we're able to offer to pharmacy school graduates in order to prepare them for pharmacist roles of the future, right? So
absolutely.
when I got to Genesis, they had uh, an attempt before to start residency, but it wasn't successful, and
Gotcha.
so it was kind of a difficult a situation to kind of figure out. Um, After kind of helping with rolling out new pharmacy services and then kind of taking on new leadership roles and things like that, I think we kind of called it time to say, we can offer a quality program here. We can offer high quality learning experiences. We do a great job with student rotations that we offer to the University of Michigan and to Ferris State University's College of Pharmacy. And we think we could kind of push this further and
Yeah.
elevate what we're able to offer. It's grown over time. It's not something like when you start a residency program, you've got it all down pat.
Yeah.
And it's something that kind of grows and kind of improves in terms of the quality of the learning experiences and what you're able to offer the residents year after year.
Yeah.
And we've been able to do that. And really, I think too, another push to think about with starting residency programs is that it really catalyzes what you're able to accomplish with your goals related to pharmacy services that you deliver to patients too. So
Absolutely.
there's so many reasons to do it, and of
Yeah.
course you want to have the right infrastructure, but you have to be okay to say, yeah, let's do this. Let's get things moving, and you can't have things absolutely perfected right off the bat. So that was one of the biggest challenges I think we had to face.
Yeah. Thank you. And I think like every year, like last year, like 6,000 plus candidates applied.
Mm-hmm.
We don't have enough programs. And so I really admire bold individuals like you. I think it's a bold move and decision to take a leap forward that way and wanting to contribute to like the future of the profession of pharmacy on such a platform and on
Mm-hmm.
such a scale. So we definitely are glad that there are more people like you that are thinking about the future of the profession in such a way and helping create new programs that are contributing immensely to training highly qualified pharmacists of the future. Like you said, I really love that pharmacists of the future mindset.
Right.
Yeah.
Right. And I think there's so many things too. Like when you go into residency, you get this high quality clinical experience where you're learning what's in the contemporary guidelines and things like that. But there are so many, I guess I would call them like translatable skills that you can take from your residency year that
Yeah.
you can take throughout your career that kind of help you adapt to whatever environment that you're practicing within. And so we try to impart that with all the residents that we train.
Absolutely. It's the all the other things that you had no idea
Oh, yeah.
residency was going to give you. It's like I just wanted to come here to learn how not to hurt anyone and be a good pharmacist and
Yeah.
take the best care of my patients. And then you learn, oh yeah, you'll get that. But there's all this other stuff that we're also going to give you. And you probably had no idea that you were signing up for that, but you need it. Trust us, you need it. Um,
Right.
and I tell students, like prospective candidates, is like residency year is challenging. It's literally designed and meant to do that. So don't go into it with this idea that this is going to be like another breeze and it's going to be all great. It's an investment. It really and truly is. What is, from a director's perspective, that you've kind of observed over the years, both as a previous resident, but also somebody who's precepted and you're currently precepting, as well as being a program director? Some qualities you really think sets residents apart. It's tough for all of them, but you have some residents that manage that tough road slightly better than others. Some advice for prospective candidates on how to go into this new chapter and new journey for their profession, for their journey.
Yeah, yeah, absolutely. And great question too. And we get asked this quite a bit. When we do like our residency showcases or, when we have our residency interviews, there are so many things that you can look at as a program leader or a preceptor, and candidates that you're trying to, match with through the residency process and the interview process. Some of the things that you can try to, recruit for are more teachable and more modifiable versus some things are not. And I think one of those big things is initiative or drive, that internal like hunger
Yeah.
for wanting to take on more and wanting to engage with something that maybe you haven't done before in your practice. I also kind of allude to this whole concept of being willing to step outside your comfort zone.
Yeah.
There's this like bubble that has all the things that you're really comfortable doing in pharmacy practice
Yeah.
that, yeah, I can, call for a copy or I can, call the nurse to let them know that the dose is ready, right? But then there's all these things outside of that comfort zone like making the intervention with the attending on rounds, or having a difficult conversation with the patient about a medication adherence problem or something like that,
Yeah.
that maybe they're further outside the comfort zone. So
Absolutely.
those two things are very closely related to one another. And I think the thing that we try to pick up on with that is during the interview process, we try to ask questions. Tell me about a time when blah 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 blah.
Yeah.
We're looking for those
We
specific
love
examples.
those
Oh
questions.
yeah, yeah, the behaviorally based interview questions. Yeah, absolutely. Or in letters of recommendation, we're looking for like preceptors to say, you know what, Susie did a great job educating this patient. And here's a specific time when she really dug deep and tried to figure this out.
Yeah.
And so showing that initiative is, I think, a really big thing.
Very.
That's one of the biggest things. And I kind of also tie it, it's like three different concepts in one. Somebody's willingness to take responsibility or ownership of the pharmacist practice responsibilities that we have for them
Yeah.
within the different rotations that they complete.
Yeah. I really hope you guys are paying attention. This is some really serious information and knowledge that we are getting here. And thank you so much for all of it. Some of the other question was, I was like, I'm going to ask you this. What is the number one thing that can happen in an interview where you just know this is not going to be a fit? So
Mm,
I was like reading that question and I'm like, one thing? Like
yeah.
one
Usually, well, this sounds so funny, but like we do have mercy. Like it's not like we're like, it's like a deal breaker and you're out of here. But I think that are there any main deal breakers? I just think unprofessional conduct is maybe that one thing. Like if somebody really were to fly off the handle or say something that really doesn't exemplify professionalism during the interview process. I think that's the big thing.
Yeah.
Usually, if we choose not to rank a candidate, we kind of have to have criteria in terms of what would that constitute. Because we want to give people a fair chance.
Yeah.
It would be an amalgamation of things. We'd have to take multiple preceptor
Yeah.
perspectives kind of into play. There'd be a lot of considerations that would be given to that. We take that ranking kind of process very seriously. And is there a specific deal breaker? I think it's just the unprofessional kind of conduct that could be observed during the interview process.
Absolutely. This other question, how important is it to, and there are air quotations, be yourself on interview day?
Yeah. Well, yeah, that's a really good question. So, well, I think authenticity is really big. And like when I talk to our residents that we have this year, we just had this conversation just because we've had a couple local showcases. Authenticity is key, right? So when we go out to the showcases, people can tell when you're making stuff up, right? I mean, it's just like I think we can generally have a read,
Yeah.
everything's fine here, in the face crack kind of thing. But with that, I said, hopefully what you have to say is positive about our program. You're able to kind of share what your experience has been like. There is no perfect residency program. There's no perfect rotation that you'll complete on residency. And I think each of those has opportunities for improvement. It'll have strengths of hopefully, of course, but there will be things that need to be worked on, from the preceptor standpoint, learning experience standpoint, and just the general cohesiveness of the resident working with the preceptor on those things as well.
Yeah.
I guess authenticity during the interview process. You want to maintain a good level of professionalism during the whole interview process. I think where you can kind of share a little bit about yourself, or maybe talk a little bit about some of the things that make you unique as a candidate, or kind of test the waters to see where you may vibe with a preceptor or a program, is maybe where they ask you tell us a little bit about yourself, and you can interject, here are a couple of hobbies that I really enjoy. And I've had people share with me that they love playing tabletop board games, and then that starts a whole conversation, or they really like reading Stephen King novels, or something,
Yeah.
kind of quirky, and
It
that's
is.
always appreciated too. And
100%.
yeah,
I'll never forget it. Like on my residency interview, I hit it off with the preceptor simply by saying, and I am a diehard soccer fan.
uh-huh,
I instantly saw like his eyes light up, like the energy completely shifted. He became relaxed. I became really relaxed because, like, what? You're a soccer fan too? And of course, Lord and behold, he's a fan of a rival soccer club. So
Oh,
it's all over with after that. But it was one of the most enjoyable experiences of the entire interview process for me because I felt seen. I felt like
yes,
I have connected with this preceptor, this on a as a human being. Like
right.
it wasn't about programming or anything. And I try to encourage students like the person interviewed, like they have lives. Like
Yes.
not pharmacy 24/7. They have lives, and you're just going to be blown away by someone who absolutely fits like your hobby, or they think your hobby is so interesting and want to learn about
Hmm.
what it is. So
Hmm.
I back to the whole authenticity thing. It's so important.
Yeah.
I'm like say looking the other questions, and I know they want answers to this. Will you be at the showcase at mid-year?
Oh, of course.
Of
Yeah.
course, okay. And then another person wanted to know if I was interested in your program,
Hmm.
what would my CV look like? That's just the same as what does a well-rounded candidate
Right.
at Genesis look like? And I feel like you kind of addressed that a little bit. As a program director and somebody who's just starting out in their pharmacy career, and I think I want to do a residency, I am not sure. What advice would you offer me in my journey to help me decide and figure out if postgraduate training in
Hmm.
general is a fit for me, or if residency specifically is a fit for me? I was like, whew,
Ooh, that's a heavy question,
that's a
right?
heavy, I was like,
Yeah.
that's loaded.
Right. Well, I think you have to get real with yourself and ask yourself, what are my career goals? Where am I now? Where do I want to be? And is residency the pathway forward to getting where I want to be? Sometimes the answer is yes, and sometimes the answer is no. The other thing I think about is your heart in residency. Residency, it seems like 12 months won't be very long, but it can be a very tough 12 months if you're not invested in the program as much as the preceptors and the program leaders are invested in you. So again, it's kind of like that soul searching piece, like, am I in it for this? Am I willing to invest the time and energy and the nights that I'm going to spend working on different projects, preparing for patient presentations and things like that?
Mhm.
Is that for me or not?
Yeah,
And then I think about, so there's an overarching statement related to what the goals of PGY1 training are,
yeah,
and it's related to readiness for PGY2 training.
mhm,
So kind of that pathway to specialization,
yeah,
readiness for board certification,
mhm,
and then preparation of pharmacists to accept direct care roles and clinical pharmacist roles after graduation from a PGY1 year.
yeah,
Um, are you invested in those pathways? Like, is that what you want to work towards?
yeah,
Um, I know a lot of people that have very happy careers without doing residency,
mhm,
and they're in different roles and responsibilities, maybe than those that maybe are trained for residency. There's some that will overlap a little bit too.
really.
But if you want to remain open to some of those experiences that may be beyond what you can reach without a residency, you really should consider doing residency. But you have to have your heart in it. It's so hard,
It's
and
so
I think
hard.
ultimately
It's like I was just like,
it's so
you
hard.
guys, like that was from the mouth of a director. I know I say it all the time.
Yeah,
It's not easy. It is
no.
intentionally designed to be hard. And having that clarity of purpose of why am I doing this?
Mhm.
When that is solid, it doesn't matter how hard that going gets because you'll go right back to that purpose of why you wanted to do this in the first place. It re-energizes you in a different way. And so I tell students like the soul searching, like I don't even care what you call it, but you've got to be sure about why you're doing this. because you're going to be tested. Your level of commitment, your dedication, your commitment, all these different things are going to be tested, and you're going to be asked to elevate your skills to a whole
Mhm.
new level. And that's not without being taxing. And so, like, be clear about your why. And I promise, like, it's gonna get hard, yes, but it's also designed to have good support systems in the program and people that you can go to that can help guide you when you just seem like you're twisting in the wind.
Right, right. Well, and these months, like, like October, November, and then oftentimes like early part of the year,
Yeah.
of the calendar year are some of the most challenging because these months are really when the research project starts ramping up or the residency project starts ramping up. And
Yeah.
then January, February are when candidates start looking at PGY2 programs and start seriously applying and then interviewing and things like that. So it's different to ask a resident at the beginning of their residency year how things are going versus now or like January or February. And the other thing I'd say is talk to a mentor, like somebody that you've trusted, that you've developed a strong relationship with, that can
Yeah.
give you sage advice about, do I do this or not? A lot of
Absolutely.
times if we've had people on rotation or if we've interacted with people at showcases, we know those who are really enthusiastic and really are serious about residency. And
Yeah.
it comes across, again, I think it's hard to mask that
Yeah.
about how you're feeling. And so we can sense that sometimes too in candidates if they're not um, taking residency seriously.
Yeah.
That's okay. It may not be for you, but we often can sense that.
Yeah. Oh my goodness, this has been so awesome. Like, thank you so much. So I know I speak for everybody who'll have an opportunity to review this. And again, guys, like, literally the number one question: will you be at mid-year? After everyone got over how young you are, they were interested, they were interested in just learning that they'll have an opportunity to engage and meet you at mid-year.
Yeah.
So definitely expect your booth to be busy.
Sure. And
Uh,
it's Tuesday morning. So we're actually with all the other Ascension Health residency programs. So check us out. I want to say our booth number is like 5258 or something like that. And I have a
oh my
weird
gosh, do you
memory
know
of
the
like
number?
numbers and stuff like that. So it's just kind of a quirky thing about me. But it's Tuesday morning, I think 8 to 11.
Oh,
Check us out. I think our strengths really lie in some of those acute care areas of focus,
yeah,
in emergency medicine, critical care, infectious diseases.
yeah,
But if you're somebody that wants a well-rounded residency program, I think we could offer a great experience at a community teaching hospital,
yeah,
400-bed community teaching hospital. We're growing in ambulatory care.
yeah.
We're establishing a specialist position, so there will be learning experiences in that arena as well. Again, kind of adding to the diversity of learning experiences that we
Of
can
learning
offer.
experiences. Yeah, and 400 beds for a community hospital. That's a decent size.
Yes, yes. And it's
That's
still
a
like the
decent
size of
size.
hospital where it's, like I worked as a clinical staff pharmacist now. It's been, 7 years ago. And I still will walk the units and know the nurses that are there
Oh,
too and some of the
nurses,
healthcare
yeah.
providers that are there.
The benefits of a community hospital. It
Yes,
really is a community. Really
exactly.
is a community. Oh, thank you so much. I can't thank you enough. And I'm not going to volunteer your information or your inbox. Is it okay for students to reach out to you via LinkedIn?
Absolutely.
Or okay, cool. So I am so grateful for the chance, and thank you for taking me up on this, and thank you for your time. Please have a wonderful rest of your evening, and I'm definitely coming to visit at mid-year.
You got to. All right. Stop by and say hi.
I
Yeah.
will. I will. Have a good
All right.
evening.
Bye. See you guys.
See you. Bye bye.